Good afternoon, everyone. This is Mary Haller with the Ohio Department of Medicaid, and we are grateful that you are joining us today for our webinar on how to enroll as a behavioral health practitioner in Medicaid, in our Medicaid information technology system. I am joined here with a number of colleagues. Let me go around the room and ask them to introduce themselves to you. First.
Monica Pegg, I'm from the Ohio Department of Mental Health and Addiction Services.
Very good. And then we are also joined by colleagues from the Ohio Department of Medicaid Provider Enrollment Section.
Hi, my name is Lawrence Yawn, Provider Enrollment.
Wayne Morgan, Provider Compliance.
Very good. And thanks to our other colleagues, especially our colleagues from Deloitte Consulting, who are assisting us with the webinar today. And I'm also joined by a couple of colleagues, Sarah Zielinski and Nicole Small, from our Medicaid policy section. Okay, let's do a little housekeeping first. Mike has had up the slide that instructs you how to connect to the audio. So hopefully you have been successful in doing that. If you are having problems with the audio, please send us a note via the chat box, and we will work with you privately offline to try and get you connected to the audio. So moving on. This is just our title slide for the webinar today. And some general housekeeping information. This webinar is being recorded, and we will be posting it on the behavioral health or bh.medicaid.ohio.gov website. It will be up there for quite some time, along with the slides that we are presenting today. So you will have a permanent record available to you if there are members of your staff who weren't able to participate today, or if you are aware of staff from other agencies who weren't able to participate today. Please direct them to the website and they can review this webinar. There are several ways that you can submit questions to us during the 2 hours of this webinar. First, you can submit them via the chat box in writing, and we will do our best to try and keep up with them. If we are not successful, which we probably won't be, in keeping up with all of your questions, we will take some time at the end to go through all of the questions and try and respond to them. One of the other things that we're going to be doing is developing a frequently asked question document from the webinar today and other questions that we have received, and we'll be posting that on the website as well to have that as a resource for all of you. Again, the website is bh.medicaid.ohio.gov. Okay, so, and we may be responding to you privately by typing questions, or we may respond publicly depending upon the level of questions, whether we think it's pertinent to a larger audience. And I think that everyone has been muted by default. If we need to unmute someone to have you speak and have a conversation, you can request that, and we can unmute you if necessary. So, okay, that's the housekeeping. Here is our agenda for the webinar today. First of all, we're going to have Monica Peck from the Department of Mental Health and Addiction Services talk to us about the basic enrollment and certification process as a community mental health or community substance use disorder treatment agency through the Department of Mental Health and Addiction Services. That is probably familiar to many of you already, but we wanted to make sure that Monica walked through this so you understood the full scope of enrolling both with mental health and addiction services and then also subsequently with the Ohio Medicaid program. Medicaid behavioral health services providers must come through the mental health and addiction services front door. So this is an important step for you to be aware of. We'll talk about who the practitioners are that need to enroll in MITS by July 1st. And then after that, we will be turning to our colleagues in the Department of Medicaid Provider Enrollment section, who will be walking you through a series of slides that are replicas of the pages you will see when you go to the Medicaid Provider Enrollment website. And then we will actually do a live demonstration of provider enrollment showing that website. Then we will also talk to you about some common errors that we have seen so far in the applications that have been submitted, in the hopes that you can correct those errors and speed up the processing of your application. And finally, we will talk about how to affiliate practitioners with their employing agencies. So, and then at the end, we will be happy to take questions, and we'll, you know, given the amount of time that we have today, I think we ought to have enough time to get through a lot of the questions. So, with that, I will turn it over to my colleague, Monica Peck. I'm sorry? Oh, I forgot a slide. Thank you. So this is a slide showing the implementation schedule of the requirement to enroll your practitioners as rendering in MITS. You may have already heard via the MITS that we submitted last week, that we sent out to you all last week, that we have changed the enrollment deadline for rendering practitioners from January 1 of 2017 to July 1 of 2017. So that's what is shown on this slide. We are recommending that you enroll your practitioners no later than April 1st in order to ensure that they will be reviewed and live in the system no later than July 1st. So we're kind of picking that as our target date to ensure that your practitioners are actively enrolled. Next slide, please, Mike. And then we also have, to assist you and our colleagues in the provider enrollment section, our Medicaid policy section has developed a mailbox specific to this issue. The mailbox address is on the slide, BH-enroll at medicaid.ohio.gov. Our section monitors this mailbox on a daily basis, and we will receive your questions and respond to you via receiving them at this mailbox. So, and we would be happy to take your questions about the enrollment of your rendering practitioners, and if you have any leftover questions about your agency's revalidation, we would be happy to take those questions as well. And that is the end of my opening remarks, and now I will turn it over to my colleague, Monica Peck, with the Ohio Department of Mental Health and Addiction Services.
Hello. I'm going to discuss the enrollment for provider type 84, which is mental health, and provider type 95, which is substance use disorders providers. Initially, as a provider, you must be certified by the Ohio Department of Mental Health and Addiction Services as a provider of mental health services or SUD treatment, as an SUD treatment program before you can enroll as an Ohio Medicaid provider. The basic enrollment to complete a web-based enrollment application is online through the Medicaid website. And there are 3 documents necessary to complete the application. The agency needs to have an NPI number that is issued by the National Plan and Provider Enumeration System. It has to be unique to your provider type, whether that's provider type 84 for mental health or provider type 95 for substance use disorders. If you're applying for both provider types, then the agency separate NPI numbers in order to enroll the program separately. You would need a signed copy of the IRS W-9 form for the applicant's mental health and or SUD agency, as well as verification of a fee payment, $4. If for whatever reason you are a Medicare provider, you may use your information that you would have received from Medicare as confirmation with Ohio Medicaid. However, the NPI number and the address must match the information on your Medicaid application, must match the information of your Medicare application. If you are not certified, if you're not certified as a Ohio Department of Mental Health Addiction Services or SUD treatment provider, you can obtain that information from our Bureau of Licensure and Certification. The number for them is listed below at the bottom of the slide. It's 614-752-8880, or you can visit the webpage that's at the bottom of the slide. Next slide. Once you have uploaded the required documents, the W-9, the fee payment, and the NPI verification, you have to notify the Ohio Department of Mental Health and Addiction Services that your application is complete. You would have to send an email to the mailbox listed on the slide, which is mhas-support@mha.ohio.gov. And in that email, you want to include the ATN, which is the application transaction number, which is automatically generated when you complete your application and upload the required documents, in the subject line of the email, along with the contact information for the person who is responsible for getting the application approved in the body of the email. You provide that information, and once the Ohio Department of Mental Health and Addiction Services receives that information, they will verify your application for completeness and then send that completed application to the Ohio Department of Medicaid Provider Enrollment section for final approval. If at some point once the application is completed, there may be a site visit, and there's more information regarding the site visit that will complete your application if you click the link on the slide. I think now,
okay,
is Dwayne, our provider enrollment.
Well, it's Mary, and I'm just going to say a couple things here. So first of all, we're having some comments from those of you who are listening about the sound. And so I'd like to ask, how is the sound now? Is it any better? We've done a few things to try and improve. So can you just give us a general idea of how things are going with the sound now? It's better. Okay, good. Good. And someone also wanted the call-in number. So just to repeat, the call-in number via phone is 1-844-882-6682. Repeating, 844-882-6682. And the PIN, which you type in followed by the pound sign, is 343-901-174. Repeating, the PIN is 343-901-174. And you will be automatically muted when you dial in that number to get connected by telephone. Okay, just to move back to our slides now. Thank you, Monica, for your presentation. As I said earlier, I'm sure that most of you in the audience are already certified by the Ohio Department of Mental Health and Addiction Services, either as a mental health or an SUD provider or both. However, if you do need to become certified and enrolled with them, you would follow the instructions that Monica just gave you. Okay, so this slide shows a listing of the individual practitioners who must be enrolled in our Medicaid Information Technology System by July 1 of 2017 in order for your agency's claims for services rendered by these individuals to be processed successfully. In order to enroll, you're going to need to have the following information available. Each of these individuals is going to need to have an NPI, a National Provider Identifier Number. They're also going to have to be enrolled in Ohio Medicaid, and they will need to be affiliated with your agency. So those are the tasks that we're going to be walking you through today, but you will need to start by getting them an NPI if they don't already have one. In the list of the rendering practitioners here, you can see we've put in parentheses after each one of them their provider type in MITS. So should you need that information for anything, that's what those numbers are that are in parentheses following the, right. So that's what the numbers are that are following the listing of each one of these practitioner types. My colleague, Lawrence Yon, is reminding me that in the case of registered nurses and licensed practical nurses, you'll see that there's an extension on that number. It's 38,384 for registered nurses and 38,385 for licensed practical nurses, excuse me. And those extensions just simply differentiate for us in our MITS system the difference between an RN and an LPN. Someone is asking a question about LCDCs. Let me speak to that. If you have employees who are not independently licensed, in other words, if they do not have the word independent in their title, or they do not have an independent scope of practice where they do not need to be supervised by anyone. In other words, if they are not on the list that is up on your screen, they do not need to enroll in this. You will represent the claims for those individuals by using a modifier on your claim, and we will be putting out more specific information about the use of those modifiers at a later time. So you don't need to enroll your dependently licensed clinicians, and you don't need to enroll your unlicensed clinicians. It's just the people who are on this list. All right. Anything else that I have forgotten to mention here, folks? No? Okay. Then I'm going to pass the microphone over to my colleagues in the provider enrollment section and ask them to walk you through the screens that you will see when you go to enroll your practitioners in MITS. And here is Wayne Morgan.
Good afternoon. So, like he was explaining in the beginning, we would actually do a live enrollment. Right now, we're just going through the screenshots to discuss some of the highlights, but you'll understand better once you see the system live. So when you first open up the system to enroll, you have an option of enrolling as one of 3 provider types.
Tell us how to get there, Wayne.
So you go, yes, I'll try to show you a little bit later, but you basically go to the Ohio Department of Medicaid website. That's what medicaid.ohio.gov. You hover over the provider label across the top. You go down to provider enrollment, and you go across to provider enrollment. And then when you get there, you'll see this page, and that's the page that will start on the live demonstration. So you have 3 different buttons to choose from to get into the enrollment screen, either to enroll as a provider to bill Medicaid, which not all providers actually bill Medicaid, but to be a rendering provider, that's the option you have to take. Or if it's a revalidation, then they would go in and select that they need to revalidate their Medicaid number. The third option is to enroll as a ordering, referring, or prescribing provider. And that takes a slightly different path than what a regular enrollment would be. So after that, when you click on one of those buttons, what it actually does is open up an instruction sheet. So right below, you can see some information about that provider type. In this instance, it's enroll as a full provider. So those are the instructions. Once you get there, you would go down to the bottom and you select New Applications. And that opens up 3A. So that's where you pick your provider type. For your employees, they're going to pick the individual practitioner provider enrollment type. And they're going to pick initial enrollment if they don't currently have a Medicaid IT or if they're not starting and restarting an application. And then below, it's, are you due to Ohio Medicaid, yes or no? And then you would select Next. And this is the screen you would see if you're enrolling as an ORP. So different instructions. And over on 3B, instead of the enrollment type would be ordering, referring, and prescribing. Once again, initial enrollment, and then you pick the provider type. So here are the provider types that can enter. Some people have asked about the nurse. So if you're enrolling your nurses, or your nurses are enrolling, they would pick 38 on the initial screen. The second set of numbers that you saw on that first slide will come into play several panels into the enrollment application.
Wayne, why don't you pull the microphone up a little bit closer, please? Thank you.
So now you get to the very first page of the application, and this is where the required fields are marked with the asterisk. No, if we have a question, if an MD is already enrolled as an ORP, do we also need to enroll them as a rendering? If all they're doing is prescribing or referring, no. If they're going to be a rendering, then yes. So individual practitioners, on this slide, it's important to know that they have to put their own tax ID. The tax ID is used for screening purposes and required by state and federal law. And then after you complete all the required fields, you press the button. Now, it's important that one of the pieces of documentation that's required with an application is a signed and dated W-9. This is required because this is how we are validating that the Social Security number that we were given on the slide is truly the individual's Social Security. So don't try to submit a copy of your agency's W-9 with the FEIN on there. It must be the Social Security number, and it must be dated and signed. So now, if you're enrolling as a rendering provider, then the next screen, one of the screens that's important is the tax ID. Once again, you put the employee puts their Social Security number, and they could put the employee's address. They should put the employee's address. And then just for ease of sake, because not everyone remembers when they got a Social Security number, you can put in 1/1 of 1900. We realize that most of your employees were not born there, but that's a piece of information you can put there. And people want to know why they have to put their address. And Lawrence, why don't you address that?
Correct. The reason that you want to include will have the employee enter their own address information, because at the end of the year, the Ohio Department of Medicaid receives a notification from the IRS of all information that we have in our system. If it does not match what the IRS has on file for when the individual files their tax documents, they are or could be in danger of withholding from the Ohio Department of Medicaid of up to 24%.
Okay, the next, or a couple of panels in, you have to complete address information. These addresses can all be the same, or there's 4 different addresses. You can actually put 4 different addresses. And after the person is enrolled in Ohio Medicaid, they're able to self-service any changes in address. So, and the specific steps for how to change an address after the enroll is in the appendix part of this slide. So, for instance, for the nurse that is enrolling and they're not a home health nurse, then this is where they select that specialty. You'll pull down the menu. There's a pull-down menu. They would select either behavioral health RN or behavioral health LPN, and click that as their primary specialty. And then the very last page is the certification page. So up at the top, the legal entity should be the name of the individual practitioner. And there is an email address that is required. And then there's several questions that must be answered, including signing the Medicaid provider agreement. One of the common issues people have is that this panel requires you to scroll to the bottom of the provider agreement as a way of assuring that you have read it. So the click button that I will do that doesn't show up until you have scrolled through the screens.
Wayne, we have a question here that maybe you can respond to verbally. Someone has asked if they already submitted the W-9 for an employee, should they resubmit the W-9 again?
Okay, I'm leaping to the conclusion that because you're asking the question because maybe you submitted a W-9 for the agency instead of the employee. If that's the case, yes. You're able to go on to the web portal and update an updated W-9 for the employee. And after you've completed this panel, then it comes up with a list of documents. But basically, for your employees, all they're really going to have to upload is a copy of the W-9. And this screen shows you how you can upload the document electronically.
And so, as Wayne says, this is the thing he mentioned is one of the common errors that we have seen, that some agencies will submit tax information and identification information for their agency instead of for the individual practitioner who they are attempting to enroll. And that will cause the application to not be processed, and you will receive an error message back from our provider enrollment colleagues who will say to you, you need to identify the Social Security number and the W-9 for the practitioner, not for the agency. And there are other common errors that Wayne will go over now, more as well.
Okay, so as you can see from the screenshot here, other things or other issues that we seem to encounter frequently are the W-9 form not being signed by the provider and dated as well. The practitioner's name on the Medicaid application does not match MPPES. We in the provider enrollment unit screen our applications through several different websites to assure for accuracy. One of those is the MPI database, also known as the MPPES database. So you want to make sure that the individual's name is entered in MPPES matches the name that you're entering on or matches the name that's entered on the Medicaid Another thing is, in order to complete the full circle, which we'll go over later on as well, you want to make sure that your applicants or providers are actually affiliated with your organization. That is the way that MITS recognizes payments when claims are submitted.
I think we're supposed to go live. Okay, so give us just a second. We're going to switch computer screens here, so we can show you a live demonstration. Okay, so once you've gone to the Department of Medicaid website and you've covered over providers and you've gone to provider enrollment, this is the screen that you're going to get. So what you want to do is go down, or whoever's applying needs to go down to provider enrollment and select it. Now, this is a newly enrolling provider, so I'm going to click Enroll with Ohio Medicaid. I'm going to go down to the bottom. I'm going to start a new application. I'm going to, the enrollment type is going to be an individual practitioner. It defaults to initial enrollment, and I'm going to pick what my provider type is. In this case, I'm going to pick a nurse, and I'm new to Ohio Medicaid. And all I do is fill out the required fields. In most instances, an individual is sole proprietor.
And Wayne, if I might ask a question, you selected sole proprietorship here, and I think some of the participants in this webinar may be confused about what ownership type they should select, given the fact that they are employees of an agency.
Right. Well, but if you will, you know, they are an entity of themselves. So sole proprietor means that, you know, they're responsible for their business, and their business is being an employee. So they would select sole proprietorship.
Okay.
And this is a test database, so none of the information I'm giving here is accurate information. So after I hit next, what comes up is a screen telling me that my application tracking number is 193758, and the name is associated with worker. So if for some reason I got called away and wasn't able to complete this application, then I can go back into the system and pick up where I left off. So it's good to write down that tracking number and the name that's used. Now, since I'm enrolling as a full provider, I have to give tax ID information. This is the individual Social Security number.
And Wayne, can you explain again why that individual Social Security number is needed?
It's needed because we are required by state and federal law to screen individuals to make sure that they have not been excluded from Medicare and Medicaid, and that they aren't, if they are able to receive federal funds, because Medicaid is partially funded by federal dollars. We also screen individuals through the Ohio Department of Developmental Disabilities Abuser Registry, and also we screen them through the Social Security Debt Master File. So we have to know who they are, and the unique identifier for all those databases is a Social Security number. Now, after I put in the effective date, so there's three questions here. It says tax ID exempt. Well, no, I pay taxes. Am I going to turn in a W-9 form? Yes. And Form 147? No. And the state is Ohio. And the phone number is not required here, so I'm not going to put one. DEA is not required. This application basically is not necessarily driven by provider type. It's driven by application type. So there's some questions that apply to some individual practitioners that would not apply to all practitioners. That's why you see some panels that ask questions that don't seem logical to you. The telephone number is required. So I've completed all the asterisks, all the fields that are asterisks, so I can go to the next. So this is the pull down we were talking about. The behavioral health nurses are at the very top. This happens to be an RN, and I'm going to select that as primary specialty. If you don't select primary specialty here, the screen won't let you go through. I'll show you. Up at the top here, it says primary specialty not found. So I'll select it and go to next. Typically, each screen, if you fail to put some required information, it will not let you go forward until you complete it. Here's a panel where you can put language, if a person speaks another language. This is where I can affiliate with a group. So at the time of my enrollment, if I know what my employer's NPI number is, I can go ahead and associate myself with that group and prevent my employer from having to do that later. But since I don't know my employer's NPI, I'm not going to put that information right now. And then now we have a series of questions and ask about whether I have federal law or several of those type of questions. So have I ever been indicted or convicted of charges related to all these federal titles? I haven't. I click no, I go next. It's a similar question. I read it, I haven't been, so I go next. I haven't been, so I click no and go yes. Have I ever been issued a Medicaid number? No. And I click next. And I've never been sanctioned by Medicare. So my legal name is me. My address is correct. So I have to put an email address, even though I put it earlier. And I have to put a preferred contact method. And then I'm asked another series of questions. Each of them are defaulted to I do not accept. However, that's not an acceptable answer. So I read the question. I say I accept it. I read it. I accept it. Now I'm down to the Medicaid provider agreement. You'll see that I can scroll all the way through it. I accept it. And now I'm going to sign my application electronically. So I say that I have everything that I've provided is true and accurate. And then because it's my application, I sign it. And then I tell the system how I'm going to submit any documentation. And then if I want to jot a note here, I can. And now I've submitted the application. This is UAT, so it doesn't always work as fast as what the production copy would do. But you can see in a period of less than 15 minutes, I've gone completely through the application.
So Wayne, while we're waiting, we might help people with selecting all their questions, and we'll do a question and answer presentation and after work.
As you all are asking questions electronically, we are collecting them, and at the conclusion of this session, then we'll be answering your questions. And so my application has been submitted, and it gives me information here that I can look over. It tells me that what I'm required to submit is IRS Form W-9. And if I happen to have that W-9 scanned on my computer, I can go to upload required documents, and I can go ahead and automatically upload it. If I don't already have it scanned, I can come back to that application. When I go here, one of the things that I can do is it says provider enrollment status. So I didn't write down that number, but I could click that. I could write down the ATN, or I could enter the ATN that the system gave me when I enrolled a couple of minutes ago, and put in worker, and then hit search. And when I do that, I could go back to that application and upload documents to it. I also can see where that application is in the processing queue.
We've received a number of questions about how to modify an existing application. So this is the example of how you do that.
Well, after you have submitted your electronic application, or after an electronic application is submitted, you're not able to make changes to the application itself. However, you can upload additional documentation to support things that have occurred that you discovered after you submitted that application.
So what do they do if a name is misspelled?
If you misspell a name, the best thing you can be able to do is call the provider enrollment hotline. That number is 1-800-686-1516. And you can follow prompts to get to the provider enrollment area. I think now we probably need to go back to the slide presentation and go over a couple of the things that you can do after. So all practitioners who are enrolled in Medicaid and are employees with an agency have to be affiliated with your agency. And this must happen prior to July 1st of 2017. So to do that, you would log in to MITS using your secure account. You would select group member. You would scroll down to the group member panel, and it'll show you who's already associated with your group, and then you're able to add additional providers to your group. I'm not sure if we have a screenshot of that. And agencies that are dual certified as MH and also SUD must affiliate with each practitioner. So when you sign into your secure account, this is your opening screen, and the banners across the top vary by provider. And here you can see that it says group members highlighted, and when you highlight that, it comes up and shows you what's in the group member. This is an example of one where there is no group member. So you would go down into this area, you would put the individual's NPI or Medicaid ID, and then you search, and it would come up, and then you're able to add them to your group, give an effective date, and get an end date. So I think this basically shows the end result of having done that. And the same way, if I'm an individual, I could have done that at time of enrollment. If I didn't do it at time of enrollment, then I'm able to do it also myself by signing into my secure account and linking to all my employers. And if I want to unaffiliate, then I go back in. Instead of having the end date of end of time, which is December 31st, 2299, I would go in and put an effective date based upon upon the date when the person, they were no longer affiliated. So now we're down to the questions. Just a minute to be able to get the questions ready.
So can we move the microphone over here? We are changing some logistics around here to be able to go through all of the questions that have been submitted. So I'm going to sort of act as the moderator here, and what I will be doing is going through all of the questions that have been asked, and then asking members of the panel here to respond to those questions. So the first question is, we have an LPC who has an NPI number and sees Medicaid clients. I do not see an LPC listed. Could she still see Medicaid clients if an LISW signs off on her files? Yes, an LPC can see clients. However, she does not need to enroll in MITS because she is not an independently practicing clinician. And you would be listing her supervisor, the LISW, as her supervisor on those claims. The dependently licensed individuals, LPCs, LSWs, LMFTs, and others that I'm probably forgetting, LCDC, do not need to enroll in MITS. They do need to be supervised by an individual who has the scope of practice to supervise them. So your LPC does not need to enroll, even though she does have an NPI number. Okay, here's the second question. Christina asked, when you say certified through ODM HAF, do you mean the certification that is completed when someone is CARF accredited? Thanks. Monica, are you able to answer that question, please?
No, the CARF certification is separate than the certification that you would receive from the Ohio Department of Mental Health and Addiction Services. However, the CARF certification does help speed the process along with the Ohio Department of Mental Health and Addiction Services. If you're certified by CARF, your application or certification department is processed a little faster and a different process than if you had to go through the entire process that OMAS has in place for certification.
Okay, the next question is hospital-based. Someone is billing hospital services incident to, and they want to know which application to use. None of the information we are discussing today is relevant to hospital services. This is relevant only to community mental health and community substance use disorder treatment service providers. So in MITS, that is provider type 84 and 95. So if you work for a hospital, this information is not relevant to you unless your hospital is enrolled with us as a provider type 84 or 95, and then you would follow the same instructions that we have gone over today. The next question, if an MD is already enrolled as an ORP, do we also need to enroll them as a rendering practitioner? No, you do not, unless that individual wants to bill Medicaid independently as their own physician practice, separate from the provider agency that is employing them. That would be the only circumstance in which they would need to enroll separately. There's a question that says, can you repeat the information on the tax ID? You're going to have to help me.
I'm not sure what you need repeated, but basically we are required by state and federal law to screen individuals that are enrolled in Medicaid. As a result, we have to use the Social Security number as the screening, because that is the common number, or it's the common identifier used for all the federal and state exclusionary databases that we use to actually screen a provider. That would include the Office of Inspector General Excluded Parties List, the System for Awards Management, which is the Government Service Administration exclusion list, and also the Ohio Department of Developmental Disabilities Abuser Registry.
And Wayne, while you're here, we've also received a number of questions about the 1099. A number of individuals have expressed concerns regarding that if they complete a 1099, that they may receive a 1099 at the end of the year for some amount of money. And so Wayne's going to explain that to you.
Most of these people are enrolling as your employees, so they're not billing Ohio Department of Medicaid directly. The only way a 1099 is issued at the end of the year is if the individual practitioner has billed the Department of Medicaid $600 in that calendar year. A 1099 is not just generated because the person's in the system. We have hundreds, well, I will say thousands of physicians who are enrolled with Ohio Medicaid that never bill Ohio Medicaid because they bill through their group practice. So you won't get a 1099, you don't need to worry about it, but you do need to give us your Social Security number because it is required by state and federal law.
Very good. Perfect. There was also a question about if someone changes their name, do they need to submit a new W-9? So if someone changes their name, do they need to submit a new W-9? So someone gets married, someone gets divorced.
Any time an individual changes information, any information, including an address example, but if you change your name, you are required by state law to notify the Department of Medicaid within 30 days of any change. Depending on what the change is, we may ask for certain pieces of documentation to support it. So once again, any change in information. I also saw a question about somebody who incorrectly gave their date of birth. They maybe fat-fingered the date of birth, didn't realize it until after they reviewed the printout of their application. Anytime you need to make a change to an application, once it has been submitted, then you need to call the provider hotline. And once again, that number is 1-800-686-1516, and follow the prompts to get to the provider enrollment area. Once again, if you're making a change, they may ask for certain pieces of documentation to support your change.
Very good. Thank you, Wayne. Okay, the next question. We have a provider that was previously enrolled with Ohio Medicaid when we hired them. Their NPI is correct, but their name is misspelled. How can we correct that? So I think the answer to that question is what Wayne just said. You need to call our Medicaid provider hotline at 1-800-686-1516. I feel like I'm on NPR asking for donations. That number again is 1-800-686-1516. And listen for the prompts until you get to provider enrollment, and someone there will help you with the correct spelling of your employee's name. Someone made an observation that they used unknown as their ownership type, and their application was successfully processed. So apparently unknown worked in that case. If a psychiatrist already has
Everybody should always report.
Hold on one second.
The correct information. Not really. If it came through that it was an error on our part.
Okay, so unknown is not a recommended ownership type, and so please use it's sole proprietorship. Is that the right selection? Sole proprietorship is the right selection for ownership type. The next question, if a psychiatrist already has a Medicaid provider number, do we need to complete an application for them again or just affiliate them to our agency? You just need to affiliate them with your agency. And make sure if your agency is enrolled with us, both as a mental health and an SUD provider, that you affiliate them with both lines of business. So you'll need to log in twice, once under the identity of your mental health agency and once under the identity of your SUD agency, and affiliate that psychiatrist with both lines of business. There's another option.
Or the doctor himself can sign into his secure account, and from his secure account, he can associate himself with both of the entities in one fell swoop.
Very good. Very good. We're all about efficiency. So if I am billing under a physician, am I still going to select sole proprietorship? Not quite sure I understand billing under a physician. So we have to sort of interpret this question because we don't really understand what it means. Billing under a physician could mean that you're trying to enroll a physician who's employed by your agency.
When they say physician, they actually mean physicians, professional medical group.
All right. Well, maybe the person who asked this question will write into us and give us a little bit more explanation about what you mean when you say, if I am billing under a physician. So I'll leave that for whoever asked that question.
These are individual providers that we're talking about.
You need to speak on the microphone because they can't hear you.
I mean, just say that it's okay. I think it's not now. It's really full providers.
If that's an error that we made in a document that went out, then that's an error that we'll have to live with. But we're asking you to really report, to give us factual information. And, the fact that you are, even though you're not earning money independently, you kind of are a sole proprietor of your life. And so you should enroll as a sole proprietor, or the individual should enroll as a sole proprietor.
While you're there, we have a number of questions about address. Which address should individuals who are enrolling list? Should they be listing their home address or their agency address on the application?
If it were me and I was the one enrolling, I would want to put the address where I receive my mail at home. However, there's nothing to prevent them from putting their business address.
And how is that address used, just so people can understand what the purpose is of listing their address in MITS?
If you look at the address listing, there's 4 different addresses, and each of those could be unique. So there is the home address, the home office address, there's the service location address, there's the pay to address, and then there's the mail to address. So I would use, I would, if I was putting different addresses, I would put them how they're appropriately identified. Or my mail to address, I probably would put my personal home. My service location, I probably would put my employer's location.
Very good. Thank you very much. Okay, we have an RN who had an error in her birth date. I think we already answered that. She or the agency employing her should give a call to our provider enrollment hotline at 1-800-686-1516. Listen for the prompt for provider enrollment and ask someone to correct the birth date on that application. The next question, how long should it take for a Medicaid application to be approved? I have staff who filled an application about 4 or more weeks ago and have not heard.
Well, the Department of Medicaid had a requirement that was issued to us by CMS. It was issued back about 4 months ago that we had to completely revalidate all providers by September the 24th. So as a result, almost every waking moment, we had staff working on revalidation applications. As many of you may be aware, because your agency was required to do a revalidation. We completed that back in September. We ended up revalidating more than 65,000 providers, so it was quite a huge task. So now we're back to doing the normal business, which is enrolling new providers. So while they may have been in there for 4 weeks, they're not going to be in there much longer.
Very good. Thank you, Wayne. Another question. What if a clinician provides services at multiple physical locations within the agency? I'm assuming that this is an agency that has a home office and satellite offices. This would be a reason why your clinician might use their home address, and that way the information about them being successfully enrolled in Medicaid would come to their home and it wouldn't get lost in one of the physical locations of your agency. I would also say that if your agency's physical locations have different NPI numbers, that you will need to make sure that you affiliate that clinician with all of the NPI numbers at which they will be practicing, because otherwise when that claim comes in from that agency and that NPI number, we will not see an affiliation between that clinician and that NPI. And that needs to be there in order to process the claim. We've already answered a number of these. When we enrolled our staff, we used domestic nonprofit corporation. Do we need to go in and correct this? Yes, enrolled their individual staff using the drop-down, I guess it's the provider type. They selected domestic nonprofit corporation. I believe they are currently in the submit status.
Okay, if the applications are currently in the submit status, then you will receive an RTP letter stating that the selection that you made is incorrect. You can send an email to me. I'll do mine. You call in to 1-800-686-1516 and just ask to speak to the supervisor, and we can make the correction for you.
Very good. Thank you, Lawrence. And again, that number is 1-800-686-1516.
Now you get to see them.
Yes, if you donate now, we'll give you a recording of this webinar. Okay. Our providers have already registered and gotten a welcome letter. Yay. Will this webinar cover how to link them to our agency? We did cover that in the section where we talked about how to affiliate your practitioners with your agency. So hopefully you were paying attention when we went over those slides. If not, this slide deck will be posted on the bh.medicaid.ohio.gov website, and you will be able to get these slides showing those screenshots You will also be able to listen to the recording of this webinar. There's a question here about taxonomy number with regard to a provider application. It is not important, is what I'm being told by my colleagues. So no, you do not have to put the taxonomy number in the practitioner applications that we are discussing today. Why can't this system track all of this information with the provider's license number instead of our Social Security number?
Because the Office of Inspector General, the Government Administrative Services, and the Department of Developmental Disability doesn't use licensure as identification. It's used for a Social Security number, and it's, once again, it's required by state and federal law.
Thank you, Wayne. If an agency has a trading partner, do the individual practitioners need to enroll in Medicaid? Yes, absolutely. The fact that you have a trading partner is simply a way for your claims to be assembled in the correct EDI format and sent to us. And in order to be in the correct EDI format, you will need to have all of your rendering practitioners on this list that we've gone over today enrolled with us actively and affiliated with your agency. Otherwise, your EDI files will not process correctly. Does an LPC or LSW need to have an ATN number to get a Medicaid number if part of a group? I think I've said a couple times now that neither LPCs nor LSWs need to enroll with Ohio Medicaid. We call these dependently licensed practitioners. They are not independent. They must be supervised in order to render services. They do not need to be enrolled in Medicaid. And what will happen is when they render a service and your agency is submitting a claim for the services that they have rendered, you will use a modifier to indicate the education level of the rendering practitioner, whether it be a licensed individual or an unlicensed individual. And we will be giving you much more detail about that at a later time, and that will also be included in our provider manual, which we are still working on to get out to you in the next few months, that covers in great detail all of the changes that will be effective with behavioral health claims beginning July 1 of 2017. Under identifying information, you select Medicare provider number or Medicare participation exemption or get an error. We have staff without Medicare numbers. If they select the exemption, then why would I meet all the Medicare participation requirements? We do not understand that question. Could whoever submitted that question please write in and give us a little bit more detail about your question. Giving all this tax and personal information makes me scared. I will receive a 1099 for Medicaid like I provided services and no taxes when I'm working for an agency. Yikes. I think we already responded to that. Wayne told you a little while ago that if you are an employee of a provider agency and you have not billed Medicaid directly as an individual, you will not be receiving a 1099 from Medicaid, and you will not owe any taxes except the taxes you owe as an employee of your agency. So try and calm yourself and calm your worries about that. We do protect your personal information. It is kept very secure here at the Ohio Department of Medicaid. It is not revealed to anyone outside the agency, and it is not on any provider lists that are published by our agency. As Wayne says, it is something we have to collect for program integrity reasons, and it is required by both federal and state law. If the provider submitted an agency NPI number, will the provider automatically be connected to the agency? What if the agency has a BH and SUD NPI?
If during the enrollment process, when the individual gets to the group membership, if they put the NPI there and they put their start date and it defaults to the end of time, then once they submit that application and it is completed by Lawrence's enrollment staff, then they are linked to their employer. If they are both mental health and addiction services, then they would have to put both of those NPIs during the time of the application.
Okay, so Wayne, don't go away. Here's a couple of additional questions on that same topic. If practitioners know their employer's NPI, they can affiliate themselves with their employer. What information is needed other than the employer's NPI to perform the affiliation?
Just the NPI and the start date.
Okay, and very good. That was that question. So the LPC that is seeing the client, the name on the claim would be the LISW who is supervising her, correct? No, that is not correct. We will be talking in great detail at a later time about dependent clinicians. That's really not the subject of this particular webinar, but in this case, the LPC would be submitting the claim under that person's licensure scope of practice. So what you can see actually right now on our website, if you go to the bh.medicaid.ohio.gov website and go to the provider tab, you can see a section there that is marked, I believe it's July and August of 2016. I forget the exact dates. If you click on that tab, you will see the latest spreadsheet. It's actually a huge workbook that has a number of tabs on it that divide out all of the different services and all of the different clinicians and which of those services any clinician can render. So if you go to that workbook and you click on the LPC tab, then you can see what all the services are that an LPC is allowed to render. What you would do with regard to the person who is supervising that LPC is you would list them in the supervising field on the claim. So the LPC would be the rendering, and the LISW who is supervising that individual would be listed as the supervising on that claim. Okay. Yeah, it is the same list. We're just reviewing questions here. We're trying to keep track as you submit more questions. Yeah, she has them. Yep, I'm good. Okay. In MITS providers, group members, I am the admin. The professional group does not show on that page. So you are describing logging into your secure MITS portal, and you are the administrator of your MITS account with us, and you're saying that when you log in there, the professional group drop-down does not show on your page. I would suggest that perhaps you want to give us a call at 1-800-686-1516 and go to the provider enrollment prompt in that, and you can get someone there to help you with that. Wayne, did you have a thought?
So there's logic behind what shows up. If you're the group, then what you see is the group member. If you are an individual, then you would see the group. You don't see both. So it depends on who's looking and what account. But still, if you're still having issues, call the provider hotline. They'll assist you.
That number again is 1-800-686-1516. If a provider works at 2 locations under 2 tax IDs, what does the address matter on their NPI? I'm assuming this is the same agency, 2 locations of the same agency, 2 tax IDs. So I'm assuming that the agency is enrolled with us with 2 different NPIs is all I can imagine in terms of this. I guess I would suggest that since this is an individual practitioner, that they need to list their own personal address. Is there any problem with addresses in terms of matching with the NPI? You all don't check address.
Okay, so as far as when we look at professional groups and or organizational providers, we do match the address to what is on the NIPI site, but for individuals, we don't do that matching.
If the provider already has a Medicaid provider number, do we need to complete another Medicaid application? No, we do not. You do not need to do that. You just need to affiliate them with your agency. So if you have a physician, a nurse practitioner, physician assistant who is already enrolled in Medicaid, all you need to do is simply affiliate them with your agency. And I would also say here that if that physician is employed by more than one agency, so they do Mondays, Wednesdays, and Fridays at ABC Mental Health Agency, and they do Tuesdays and Thursdays at XYZ Mental Health Agency, then they are going to need to affiliate with both of them because claims will be coming in from both of those agencies, and they're going to need to be affiliated with both agencies in order for those claims to process. How do we make changes after we receive the welcome letter? I think we already answered this. Once your application has been submitted, and certainly after it's been processed, you can't make any more changes to your application. You will need to call the provider enrollment hotline and ask someone there to help you.
That's true in general. However, there are some things you can change. If you change addresses, you're able to go onto the secure portal and do demographic information updates. Also, if you change your group affiliation or your group members, you're able to do that on your secure well, after you're enrolled.
Very good. Thank you, Wayne, for that clarification. Another question. I work for a hospital-based outpatient SUD/mental health program that is accredited by Ohio Department of Mental Health and Addiction Services. Does this apply to my agency and to me? Yes, indeed it does. So this is a case where a hospital has an identity with Ohio Medicaid both as a hospital and also as a community behavioral health provider. And so for the portion of your business, the line of business that is community mental health or community substance use disorder treatment, and in MITS, that's provider types 84 for mental health and 95 for substance use disorder treatment, you would need to perform the practitioner enrollment and the affiliation of those practitioners with the hospital identity that is the NPI for the hospital that is affiliated with the mental health or the SUD provider type. If I already linked my providers to both accounts in their initial individual applications, does the process need to be repeated on any other account? So this is a case where when apparently the agency has enrolled the practitioners and they use the option to affiliate the practitioners with their agency as a part of the initial enrollment. So is there anything more that they need to do in order to ensure that those providers, those practitioners are affiliated with the agency? And the answer I'm getting from my colleagues in provider enrollment is no. It sounds like you did. Okay, so if you want to make sure that they are indeed affiliated with your agency, you can sign in to your secure MITS portal, as Wayne showed you earlier, to the group. What is it? What's the link or the drop down under the MITS portal? Group members drop down under the provider agency tab. It's in the slideshow. So go back and look at those slides, and you can then see whether or not they are affiliated with your agency. Now, what I would say that is if we haven't processed their applications yet, they're not yet going to be affiliated with your agency. They won't be affiliated with your agency until after they have been fully processed and received a welcome letter from us. So don't go there today and look and be concerned if they haven't already received a welcome letter from us saying that they are enrolled in our Medicaid system. And here comes Wayne with more information.
Yeah, currently the way that our computer system was configured is that they might show up even though they haven't been enrolled yet. However, that was identified as a glitch, and that's going to be removed. So I wouldn't rely on it. Once the application is processed, the individual is sent, if you will, a welcome letter, and the welcome letter is emailed to them. It's emailed to the address that is given during the application process. So if they gave their own email, they're going to know immediately once their Medicaid number has been generated. So that would be the trigger. And now someone did ask, can we start enrolling now, or do we have to wait until April 2017? By all means, as soon as you hang up this phone call, you can go ahead and start. We welcome you early.
Okay. Thank you very much. Okay. What if the doctor does not know anything about ATN and we just hired them? They want the credentialing department to find out about it. They work at 3 different places, not sure how we got it for them. So this is an agency who has just hired a new physician, and apparently they are not sure whether or not they are enrolled with us in the Medicaid system. So how can the agency go about looking them up to see if they're enrolled? Okay. Okay, so I'm being advised by my colleagues that the best course of action is for your business office to give a call to our provider hotline at 1-800-686-1516, go to the provider enrollment prompts, and then ask for some assistance. And you will need to provide identifying information about the physician that you're calling about. So you'll need to provide us with their NPI and their Social Security number in order for us to be able to help you. Okay, we are at the end of the questions that we had before we started answering questions. And now we are going to additional questions that you have asked during the time period where we have been answering questions. For non-independent providers, you mentioned the use of a modifier. Can you explain the use of a modifier? I can explain it only in general terms. I think I talked a little bit about that earlier. When a claim comes in from a dependently licensed individual, an LPC, and LSW or other dependently licensed practitioners, there are a certain list of services that they're able to provide within their scope. And so what you will be doing is you will be listing in the billing field of the claim your agency's NPI. You will leave the rendering field blank, and you will add as a modifier to that claim the modifier that best indicates the educational level of that individual. And we will be going over that in great detail with you. However, you can right now log into the bh.medicaid.ohio.gov website and go to the provider tab and to the drop down that says July something and August something, I don't remember the dates, and click on that and you will find a huge workbook, an Excel workbook that has in it the list of every single service that will be part of the new behavioral health redesign, and then there is a tab for each and every practitioner type, and if you click on that tab, you will be able to see the listing of services that they can provide, and you will also be able to see the modifiers that will modify the claims that are submitted for those individuals. And we are sending you some information, sending you the link via the chat to how to get to that part of our website. How long does it take to get a new organization or agency Medicaid enrollment approved? I'm assuming that this is in reference to the comments that Monica made earlier on about how a new organization would apply to the Ohio Department of Mental Health and Addiction Services and then become certified and then come over to Medicaid and be enrolled in the Medicaid program. So, Monica, do you have any comments about the amount of time that will take if it's a newly applying organization?
If the provider is already certified, my processing time or the Ohio Department of Mental Health and Addiction processing time is about 2 to 3 weeks. Certification right now is stating that they are taking about 2 to 3 months to process an application for certification and issue a certificate. They have a site visit and they have to have records from the provider. After the processing time of 2 to 3 weeks, it goes to provider enrollment, and I'm not sure what the processing time is for provider enrollment after they receive it from the Ohio Department of Mental Health and Addiction Services.
Well, on the Medicaid side, it's just a day or two. Frequently, we can do it overnight, so it's not a long process.
However, there's an additional site visit that Medicaid.
I beg your pardon, yeah. So would someone from provider enrollment like to talk about the validation of an agency?
If the agency is already enrolled in Medicare, then we don't have to do a site visit. If they are not enrolled in Medicare, we do have to do a site visit because these two organizations are considered moderate risk by CMS and by the Department of Medicaid. So once the application gets into the under review status, a site visit is ordered. Our contractor usually tries to complete those with, come out and do the site visit within a week. Then they come out and they do quality assurance on the site visit. Then it's sent to the Department of Medicaid for review. If we found deficiencies during the site visit, then a notice of operational deficiency is sent to the agency, and with a period of time in which they have to submit a plan of correction. Once the plan of correction is submitted to the Department of Medicaid, it is reviewed. If it's considered to be acceptable, then the enrollment process continues.
Okay, very good. The next question, do I need to add my new LISWs into my group before they enroll as an individual? I would actually suggest that you enroll them as an individual in a MITS first before you try to affiliate them with your group. However, there is a way in their application where they can select your agency as the agency with which they want to affiliate, so you can also do it that way. So hopefully that answers that question. If our agency's 5-year enrollment is not up until November 2017, do we still do it? Your revalidation will be, you'll need to be revalidated by November 2017. We will notify you when it is time for you to take steps to revalidate. Usually, a letter is sent out to your agency 90 days in advance of the end date of your Medicaid validation, and then you will have those 90 days to resubmit the paperwork, resubmit the validation fee, and then if your agency is not Medicare certified, then we will need to perform a site visit in order to make sure that your agency is where you say it's located. That's just a part of Medicaid program integrity. If a certified nurse practitioner registers as an individual provider, will they also need to register as ordering, referring, or prescribing? No, they do not. Enrolling as a rendering will do just fine. The only difference between ORP and enrolling as a rendering practitioner is the rendering practitioner would be the category if they want to have a separate practice where they are on weekends, perhaps they have their own office that is separate from your agency, where they're performing the work that a CNP can perform and billing Medicaid separately. That would be the reason why you would want them enrolled as a rendering practitioner as opposed to an ordering, referring, prescribing practitioner. But essentially, they do the same thing in terms of Medicaid enrollment. Please repeat where the list is on the bh.medicaid.ohio.gov that lists all the providers and what services they can deliver. We are sending to you, Rose, the link for that. It is under the provider drop-down, the provider tab on the bh.medicaid.ohio.gov website. And then under the provider tab, you will see a drop-down that is entitled July and a date of 2016, I can't remember the day, and August of 2016. And that is the most current information that we have available with regard to the complete list of behavioral health services that will be available for your agencies to begin billing July 1. A question from Kathy Ross. Can the agency's credentialing department enroll the provider, or does the provider have to enroll themselves? It can happen either way. But
it could happen. The credentialing department could help fill out the demographic information, licensure information. However, the last page is a legal contract between the Ohio Department of Medicaid and the individual who's entering into an agreement. And I raise my right hand and I swear. So that needs to be signed by the individual who's enrolling.
Very good. Wayne keeps me honest. I am on the website and do not see the dates under the provider drop-down menu. Maria is responding to you with the link, which I believe you can just simply click on, and that will take you to the coverage and limitations workbook. Yes. So we are now looking at questions that have been submitted to us via the chat, and we're finding that they are very detailed. Do we have contact information for all of these individuals so we can get back to them? So if you submitted a question using the chat and we haven't answered your question, then what we will do is we will get back to you because of the detailed nature of the question that you have asked using the chat. And it appears that we have answered all of the questions that have come in. If you have additional questions that are burning in your minds, you have the next few seconds to submit them. And you can also submit them to the new email address that we created for you to submit your questions. It is bh-enroll@medicaid.ohio.gov. And Mike is sending that out to you now, to all participants in the webinar, so you have that link. So please feel free to submit your questions to that email address, and my colleagues and I will review those questions every day and attempt to get back with you as soon as possible with your questions. Kathy Ross has just submitted another question. When entering the agency NPI number, what is the start date? The date you are applying, question mark?
Oh, I got you.
Okay, Wayne has had a light bulb go off.
If you're asking when you're going to link a individual to your agency, I would use the date of employment, not necessarily the date that they're making their application.
Okay. Deanne, your question was not answered. In previous instructions, the address for 1099 tax panel should be the employer, not the individual. Our provider have been enrolled this way. Does this need to be changed?
They're not, they can be the way it is.
I'm being told that your employee's application should be processed fine just the way it is. If you have any questions or concerns, give us a call at 1-800-686-1516. Daniel Mouse asks, I am hearing that only Ohio MHAS certified agencies can apply for a Medicaid number. Does that mean that MCOs will only be able to contract with Ohio MHAS certified agencies once this all takes effect? Actually, Medicaid managed care plans will not be responsible for behavioral health services until January 1st of 2018, so that is not an immediate concern. However, Medicaid managed care plans have the flexibility to contract with a variety of different providers, including those who are certified by the Department of Mental Health and Addiction Services. So, however, the behavioral health redesign is targeted at agencies that are certified by Ohio Mental Health and Addiction Services, so that is definitely the target audience for the work that we are doing in behavioral health redesign. So hopefully that answers your question. And so I would like to say thank you to all of you who have been with us for the last almost 2 hours. And we definitely appreciate your participation. Thanks very much to all of my colleagues who have helped out with this. And so we will be closing down now. Please, if you have additional questions, feel free to submit them to the bh.enroll@medicaid.ohio.gov email address. And thank you very much, and I hope you have a good rest of the day.